So for this slide, we're going to be going over core functions and essential services. So the core functions and essential services are made up of assessment, which is community assessment of population health needs by monitoring and investigating levels of population health and illness. Policy development is the development of health policies, goals, plans, and interventions to meet priority community health needs. And assurance, which is the measurement of outcomes of health policies, goals, plans, and interventions, and the competency and adequacy of public health professionals to determine whether a community's priority health needs have been met in an efficient and effective and timely manner. So the 10 essential services and how they apply to homeless families are, the first one is monitor health. Monitoring health of homeless families proves to be a challenge as many homeless families move from shelter to shelter between friends and family, as well as in hotels. Diagnosis and investigate. Homeless families often skip checkups and preventative care due to working multiple jobs, no health coverage, lack of information and resources, as well as transportation difficulties. Inform and educate and empower. When treating homeless families, it is important to determine what barriers they have to accessing health care exist, provide resources as well as options to better provide necessary care, such as mobile medical units, free clinics, and telehealth. Mobilize community partnerships. We can partner with many helpful organizations to provide services for homeless families, such as food banks, churches offering a variety of free services, and wellness centers located throughout the community that they live in. Develop policies. We can work with city council members to develop policies based on the specific needs of the community. This can include providing more homeless shelters, changing policies of existing shelters to cater more to families' needs, and providing additional food banks, free vaccines, etc. Enforce laws. Many homeless families are victims of domestic violence, abuse, sexual assault, etc. As nurses, we must report these instances and get them the necessary treatment and or resources for help. Link to or provide care. We work with case management and social services in the hospital setting to help provide assistance with getting medications for chronic conditions, clinics for follow-up care, and resources for education, mental health, rehabilitation, Medicaid services or applications, etc. Assure competent workforce. We have to make sure that our staff is properly trained has adequate knowledge on how to assess and determine the needs of homeless families, when to involve others within the interdisciplinary care team to provide adequate health care to this vulnerable population that we're treating, as well as evaluate. We have to evaluate if these homeless families' health care is adequate. Are they missing appointments? Are they not taking medications as scheduled? Getting necessary vaccines for their children, etc. We need to reevaluate their needs and determine how we can better provide preventative care as well as chronic treatment for these people. System management and research. So this kind of encompasses all of the other discussed essential services, determining health solutions needed for services and implementing new resources. This consists of working with state and federally funded services and clinics to provide primary, secondary, and tertiary prevention services for homeless families.